Continuing where I left off, unfortunately, my camera stopped. I'm going to look into your left eye. See that red reflex? I'm able to see the optic disc. It's yellow. I see the veins. Those are bigger than the arteries. It's small. Okay. Now let's check your ears. Looking at your ears are symmetrical. They are both midline. No, any pain noted to the outside of your ear? No. Okay. If I press on this, the auricle, do you have any pain there?
No.
No. Okay. So I'm going to take a tuning fork, and I'm going to check your hearing first, and then I'm going to look into your ears. Okay. So tell me if you can hear this in both ears evenly. Okay.
Yes.
Okay, good. All right. So this time I'm going to tap it, and I'm going to have you hear it on the outside of your ear, and then I'm going to put it on the little bone behind your ear, okay? Can you hear that?
Yes.
Okay.
Yes.
And which one was louder?
The front.
Oh, okay. That. And let's go to your right side. Are you able to hear it?
Yes.
Okay.
Yes.
And which one was louder? Okay, great. So now I'm going to look into your ears. I'm going to use my otoscope. And let's see. Let's move this a little bit. So I'm going to use my otoscope, pull the pinna of your ear up and back. And I'm going to looking in the auditory canal. I do see the tympanic membrane. It's nice and pearly pink. Don't see any excess cerumen or buildup. Let's look at the other ear. Same thing over here. I'm going to pull the pinna up and back. And as I look into the auditory canal, I'm going to visualize the tympanic membrane. It's nice, round, and pearly as well. Okay. Now, I'm going to test another part of your hearing. I want you to cover one of your ears and cover your right ear, and I'm going to whisper a word and tell me if you can hear it.
Okay.
What did I say?
99.
Good. And I'm going to try it again for this ear. Cover that ear. Let's see.
Yeah.
What did I say?
99.
Great. Okay. Let's see. Okay. All right. Now I need to look at your nose. I'm going to also use my otoscope. I'm going to use the largest speculum possible to look up inside your nose, okay?
Okay.
All right. So as I look in your nose, I'm able to see that it is patent. The septum is not deviated to either side. And let's look at this side. Nice and vascular pink. And it's not deviated as well. All right. And I'm going to close off one there and tell me if you can breathe through the other one. Can you breathe? Evenly?
Yes.
Okay. And what about now? Nice and patent. Good. Okay. And once again, any pressure or pain when I press here?
No.
Okay. None in your pressure or pain there?
No.
Okay. No pressure or pain in the maxillary sinus. All right. Now I'm going to put on some gloves because I want to take a look at your mouth and your teeth. Looking at your lips, they are not chapped, they're not swollen, They're not drooping to one side, they are symmetrical. Let's take a look at your teeth. Okay, open your mouth for me. All teeth are present. Any pain there? No. Okay. And stick out your tongue. Say ah. Great. Okay. I see your soft palate moving when you say the word ah. That's normal. That's good. Okay. So now I want to listen to your chest, your lungs, and look at your upper body. Okay. If you don't mind, I'm going to ask that we remove the gown so I can see your upper body. Okay.
Okay.
All right. Okay. And I just want you to breathe just normally, just fine. Just want to observe your breathing. Okay. Breathing looks appear to be normal, not labored. I don't see any accessory muscle use when you breathe. All right. So I want you to, could you turn and face that other side so I can listen to the posterior portion of your lung sounds, okay? But before I do that, let me I want to check your thoracic excursion. Take a deep breath in and out. Okay, good. One more time. Good. Awesome. So now I'm going to take a quick listen to your back. I'm going to have you take some deep breaths in and out, okay?
Okay.
All right. Deep breath in and out. Good. Nice and clear. All right. Very good. Okay. And lift up for me real quick. I want to take a deep breath now. Good. Nice. Lung sounds are clear. All right. I want to percuss across your back. Okay. Nice resonant sound. Okay. Okay. Do me a favor. I want you to say the word 99.
99.
Good. And say it again.
99.
Okay. Tactile fremitus was even for the word 99 bilaterally. All right. Now this time, I'm going to ask you to lift your shirt up. I want to check how much your diaphragm expands, okay? That's called diaphragmatic excursion. Have a pen here. All right. So what I want you to do is take a deep breath in and let it out. And then once you let it out, just hold it, okay?
Okay.
Ready? Deep breath in and out. Okay. Right about there. You can breathe normally. All right. Now take a deep breath in. And this time, when you take that deep breath in, hold it for me, okay?
Okay.
All right. Ready? Deep breath in. Okay, you can breathe out now. Okay. So let me measure that. That measures about 5 centimeters, which is normal. So that is measuring how much your diaphragm expands and contracts when you take a deep breath. All right. So now, do me a favor and turn around, and I'm going to have you lay flat for me.
Okay.
Okay. And I'm going to use some lighting on the side to visualize your carotid pulse. And I can see it right there. Good. Now, I'm going to feel your pericardium. Okay. No pulsations, no heaves, no lifts. Now I'm going to listen to your heart sounds. Let's see. All right. Let me see. Do me a favor and sit up for me real quick. I want to listen to your heart sounds sitting up, and then I'm going to listen to your heart sound laying down. One particular one you're able to call, okay?
Okay.
Let me take a quick listen. I'm going to listen to your different valves. Your aortic valve, pulmonic, good. Tricuspid, and mitral. Okay, S1 and S2 was heard. I did not hear any splitting sounds. I'm going to listen again with the bell of my stethoscope to listen for any bruise. Aortic and pulmonic, Erb's point, tricuspid, and mitral. Okay. No murmurs heard. That's good. Okay. Now I want you to lay flat one more time for me. This time I'm going to listen again to your apical pulse. This time I want you to lean a little bit towards your left for me, okay? I'm sorry. Very good. Okay. All right. S1, S2 heard again. No splitting sounds. No S3 or S4 was heard as well. Now this time I'm going to look at your abdomen, okay? If you don't mind, let me see your stomach, okay? Just looking at it, I do notice some stretch marks, but that's not abnormal for a mother that has had children. I'm going to step to the edge of the table. Do me a favor, can you lift up, like sit up a little bit for me? Okay, I don't see any bulges, any hernias. Okay, you can lay flat. Now I'm going to listen to your stomach. Listening in the right lower quadrant. Vowel sounds are heard. Listening in the right upper quadrant. Vowel sounds are heard. Left upper quadrant. Active vowel sounds are heard there. Right lower quadrant, active vowel sounds are heard there as well. Okay, so now I'm going to percuss over your stomach. Okay, some nice resonant sounds. All right. Okay, let's see if I can palpate your liver. Okay, and felt it right in here. right, so your liver border measures about 10 centimeters, so that's normal. Okay, now I'm gonna do some palpation, some light palpation. Any pain?
No.
Okay. All right, I'll do some deep palpation. Any pain there?
No.
Okay. And I want you to lean towards your right a little bit. I'm going to palpate and see if I can feel your spleen. Nope, can't feel that. That's good. All right, sit up for me. This time I'm going to palpate. I'm going to turn face that way for us. Mm-hmm. Any pain here?
No.
Okay. Any pain?
No.
Okay. No costal-vertebral pain noted. If you had any pain back here, that might be indicative of a kidney injury or kidney infection, okay? Okay, so now let's look at your blood vessels. Turn around for me. I'm going to check your pulses. Sorry about that. Okay. And I'm going to start off with your carotid pulse. I'm going to check one at a time. I don't want to check them both because that would cut off blood flow to your brain. Okay. That's even. Let's check your brachial pulse. That's good. +2 there. +2 there. Let's check your radial pulses. Good. Nice. +2. I would check your femoral pulse, but for the purposes of this examination, we're not going to do that. That would be right at the crest from where your thigh and your pelvis meet. I would check your femoral pulse there. Looking at your posterior tibial. Feel those pulses. Let's move this camera down. So I'm going to check your pedal pulses. Good. And your posterior tibial pulse. Awesome. All of your pulses are +2 in amplitude. Okay. I don't see any jugular vein distension, and I didn't notice any jugular vein distension when you were laying down. Let's check your peripheral arteries. We'll check your legs in a few minutes, but any pain noted here in your legs and your calves?
No.
Okay. They feel warm and smooth. Hair is evenly distributed. No pitting edema noted there. All right, now let's check your nerves that come from your brain and innervate your face and your shoulders, okay?
Mm-hmm.
First is the, is the olfactory nerve. So it's going to be me checking your smell, okay? So I want you to close your eyes and tell me, does this smell sour or kind of sweet?
Sweet.
Good, okay. You can open your eyes. That was the smell of a blue citrus candle. The next one, I'm going to look into your eyes again, and I'm going to check your pupils. This is checking nerve number 2. Your pupils are reacting. Both of them equal to light accommodation. 3, 4, and 6, I'm going to have you check by checking your eye movements, okay? Follow my fingers for me. Going out and in, up and down, and up and straight down, okay? And again over on this side. Very good. Okay. Okay. Checking nerve 5, smile and show your teeth for me. Good. Frown your face up and, okay, and scrunch your eyebrows up. Okay, awesome. Next, we've already done this, but we're going to check your acoustic nerve. I'm going to see if you can hear this on the outside of your ear, and I'm going to put it onto your top of your head and behind the ear there. Okay? Is that evenly heard in both ears?
Yes.
Okay. And can you hear that?
Yes.
Can you hear that?
Yes.
Which one is louder? The front. Okay. And one more time. Can you hear that?
Yes.
Okay. Which one is louder? The front. Okay. Do me a favor. Stick out your tongue and move it from left to right. Okay. Open your mouth. Say ah. Ah, good. All right. Shrug your shoulders for me. Okay. Push down. And I'm sorry. Shrug them as I push down. Great. Okay. One more thing. I'm going to have you stick out your tongue. And this time, say ah. I'm going to check your gag reflex. Okay?
Okay.
All right. Say ah. Okay. Yep. Good. Number 12 is intact as well. So all those are intact. All right. This time, I want you to take your finger and touch your nose, and then alternate and touch your nose again. And then I want you to go back and forth, okay?
Okay.
Try and do that for me. Okay, and can you do it a little faster? Good. Okay, you can stop. This time, I want you to take your finger with this hand, touch your nose, then touch my finger, and then I alternate and do it with the other hand.
Okay.
Okay. Good. And can you speed it up? Good. Awesome. All right. Now, I want you to stand up and you can take that off. And stand straight and close your eyes and try and balance yourself. If you feel like you're gonna fall, that's okay. I can catch you.
Okay.
All right.
Mm-hmm.
All right. Good. Your balance is very good. Okay. Okay. Let's see. So, do me another favor. I want you to walk to the door and back. Just walk normally. I'm going to check your gait. That's good. Okay. Very good. And you can sit down again. This time, I'm going to put something in your hand. It's going to be a typical familiar object. And tell me if you can describe what it is, okay? Put it in your, I'm gonna put this in your hand.
It's a key.
It's a key, awesome. Let's show the camera. I did put a key in her hand. And this time I'm going to draw a letter or a number in your hand and tell me if you can identify what that is, okay? Close your eyes.
M.
M, I drew it in her hand, very good. Now, I'm going to check your sensation for pain and for touch. So if you feel something, tell me if it feels soft or if it feels, I'm going to use the end of a fingernail clipper, if it feels soft or if it feels kind of prickly, okay?
Okay.
Close your eyes for me.
Soft. Soft. Prickly. Soft. Prickly. Do it again.
It's okay.
Prickly.
Okay. And this time I want you to tell me if you can tell me if it's soft and prickly and where I'm touching you, okay?
Okay.
Okay.
Prickly on my arm. Soft on my leg. Soft on my leg. Prickly on my head.
Awesome. That's good. Okay, now I'm going to check your reflexes, your deep tendon reflexes, okay? just relax it. Good. And just let it relax. Good. Okay. Let's see. Alright, I'm gonna move this down so we can look at your ankles real quick. I'm gonna check them. Sorry. Good. Good. Check your knees for the camera. Good. Let's move on real quick to your musculoskeletal system. And let's see, looking at your skin, I should have done this earlier, but I'm gonna check for skin turgor now. Your skin is not scenting, it's really good. That's a good sign that you're not dehydrated. Now, I wanna check your range of motion. Can you move your neck around? Good. All right. And let's see, can you move your shoulders, lift your arms up? Okay. Stretch your arms out and bring them down to your sides. Let's look at your fingers. Can you move your fingers? What about your wrists? Okay, your elbows. Good. Can you turn your palms upward and turn your palms downward? Okay, let's look at your knees. Can you bend your knees and your lips? Good. Okay, what about your ankles? All right. Now I'm going to try and move them, okay?
Mm-hmm.
Let me see. All right. Okay, squeeze my fingers for me. Good. Okay, now I'm going to push down on your hands and you push up, okay? Push up. Good. And do it again. Good. Very good. Very good. Now I'm going to try, let's move the camera. I'm going to push back on your legs. You push forward, okay? Good. Normal resistance and the same thing. Very good. All right. Can you lay flat for me? This time I'm gonna check your lower extremities, your legs. Okay. Checking for any edema. No edema noted. All right. Now I want you to push up with your legs. Good. And this time I'm gonna check your feet. Okay, now I want you to push down like you're pushing on the gas pedal. Okay, and push back, up. Great. One reflex I do need to check real quick is your reflex on the bottom of your foot. I'm just going to check it to see if your toes curl. Okay.
I'm ticklish.
Okay, I'll make it quick. I promise. Okay. Okay. Good. Okay, very good. Very good. You can sit up. All right. Okay, now do me a favor, stand up. I want to look at your spine.
Okay.
Okay. And let's see, let's turn this way. Turn and face the. Okay, and bend over, touch your toes. Okay. Palpating your spine. Okay, stand up. Any pain?
No.
Good. Okay. Nice curvature in your spine. Okay. I think that completes it. Thank you very much for your time.
Thank you.
Awesome.